Venturi Cardiology is an independent cardiology clinic that offers rapid, bespoke diagnostics in the area of cardiovascular medicine. So we are able to see patients and perform multiple different tests to analyse the heart muscle, to analyse the coronary arteries, to analyse the electrical activity of the heart, and to then sum all that up at the end with a consultation, so that people go away knowing the risk or having, some reassurance about symptoms they may have had. So it is a one-stop shop for cardiology investigations.
I've been at the Venturi Cardiology clinic today having my full heart health MOT. It's been great. I've had tests on my heart, I've had ECG, I've had my cholesterol done with finger prick. This doesn't feel like a hospital at all. It feels like just a nice fresh building whereby you can within an hour and a half get told what the future is for you, really.
So we created Venturi. It was born out of an idea probably about 3 or 4 years ago. We were sat down frustrated at the backlog of NHS work, and it all came together of how can we do this better and how can we offer the patients a better deal, and that was the real sort of foundation of what we're trying to do with Venturi. And what we've created here is a real one-stop shop, which is the patient can come in, have a consultation with a cardiologist, have the routine investigations such as an ECG, such as an ultrasound scan of the heart, echocardiogram, routine blood tests, and then ultimately a CT scan of the heart, either a CT coronary angiogram or a calcium score, all within the same sitting. So what we're offering here at Venturi is all that in the space of an hour and a half. To give you an idea, that time period on the NHS could be up to 6 months.
I lost my husband nearly 6 years ago now to a genetic heart condition called cardiomyopathy. Danny was a professional rugby player and he was playing at the time for Keighley Cougars, but he also played internationally for Wales. As I say, he had a genetic condition that we didn't know about, and within minutes into the game he lost his life playing the sport that he loved. Knowledge is power, and thinking about family history, thinking about anything, are you suffering, are you struggling with chest pains, can you feel something's not quite right? Then you need that diagnosis, you need to come to somewhere like here, you need to go to a screening and find out what's going on. It is just being brave, getting that test, talking to people and spreading the word as well, and spreading the word of how important this is. And we've seen in the press recently with Christian Eriksen how important it is to be tested. So please find out and take care of yourself, and don't be afraid, because places like this couldn't be better and more welcoming to come to find out.
The most important thing is that you want to encourage people to have the heart checked, because having a heart condition doesn't discriminate. It doesn't say that if you have to be a certain age. You can either be young, old, middle age. As long as you make sure you get your heart checked, that's the most important thing.
I would like to call for screening for everyone over the age of 40. If my dad had a check at 40, he may have been told, look, there's a little problem, we're going to sort it now. He didn't have a check, 12 years later he was dead. So hopefully with Venturi and with the help of myself and other people who are in a position to get awareness and spread awareness, hopefully we'll get screening for everyone over age 40.